It's really important for Robbins to be focused on access to both healthcare and access to be able to make healthy choices. In many places that have less resources, so lower income areas, it's harder for those people to be healthier. And so paying attention to the infrastructure that helps people be able to be healthier is super important. My research focuses on advancing health equity and access for all to be able to be physically active and actively play. I think Robbins is very well equipped to address this type of research. We have experts that focus not only on the behavior and on the individual, but the communities that they live in. Play streets are temporary closures of publicly accessible places, so it could be a parking lot or a field. And it's not necessarily where play equipment might be, but play equipment is brought in. And so it might look like hopscotch, it might look like a bouncy house, it might look like a dance station or bubbles or frisbees. And the idea is that in places where there isn't already a safe place for kids to be active, that this creates a free opportunity for people to bring their kids to be able to be active in that.
Robbins College is unique in its efforts to focus on health, but it's more than that. It's an expanded version of health and wellness. For me, in my Christian faith, service is how I express that. As a researcher, that gives me opportunities that I wouldn't have otherwise. Lily's Pad was born of being able to provide access to healthy play for children with immunocompromised systems. My role had to do with defining the materials that would go into the space, all the way down to what kind of flooring are you putting on the floor and how are you going to make sure that that is a safe place for kids to be on. Lily's Pad will be a living laboratory. We're looking at what kind of studies we can do to help show favorable health outcomes of children who are able to use Lily's Pad. It's the only one of its kind in the country. So there's all kinds of different ways that research in my discipline can improve health and well-being. If I'm looking at how I can improve health of a child in an environment, then I've got to go to the sciences and find out how an environment is built. That's like the secret sauce in environmental design research, is that we're so close to the user. And so we get to not only see how our research impacts them, but we get to utilize their knowledge and experience in informing what we do to get the kind of research that we need to elevate their experience.
In Robbins, it is really important that we are leading Baylor in terms of thinking about healthcare access and access to being able to make healthy choices. And I would say that Robbins has a responsibility because we have experts that can be part of the solution, and we have evidence of that across the college.